Loft 100 Studios in sunny San Diego, California. Close to 75 million television homes, maybe 76. I don't know if that number is. Biz Television Network, of course, our new affiliate of Bloomberg TV. Bloomberg Financiero in Mexico, 15 million homes there. You know, the average viewer in Bloomberg, Mexico invests $100,000 per viewer per year in U.S. stocks.
Love it.
I can tell you why.
Why?
You want to know.
I want to know.
Because if you try to wire money out of certain countries into the U.S., they will charge you tax.
Yes. Oh, look at that.
Excise export fee. One way to avoid that is investing in U.S. stocks. Punctuation?
The Meadowlark lemon is the best.
Or what was the girl's softball pitcher name? Like
Oh, yeah. Jenny,
McCarthy?
why not?
Wait, let's do something different.
No, not at all.
Something different. Hey, Dr. Tom Vo is with us again. He's the CEO and chairman of the board of a company called Nutex Health, one of our favorite guests, actually, and of course, one of those guys that talks about micro hospitals and staff burnouts and value-based healthcare. They are publicly traded under the stock symbol NUTX. And of course, nutexhealth.com is the name of the website. Dr. Vo, great to have you along, sir. How are you?
Thank you, Sully. Great to be on again.
Hey, let's talk about, so where are we seeing you today? You look like you're hanging off a cliff of a building there.
No, this is my office. This is my humble office.
Let's talk a little bit about what you call micro hospitals and value-based healthcare, because I think that's important.
Yes, so micro hospital really is a small hospital, and it's basically it's got all the bells and whistles of a hospital. It's got a ER, it's got an inpatient bed, it's got CT, X-ray, MRI, ultrasound. But even though it's a small hospital, it's a very dynamic hospital. It could treat probably 95% of the patients that walk through the door, and we treat them and we discharge them. And if we need to transfer them to a much bigger hospital, we do. But that's only maybe about 5% or less of the patients.
Tom, what's the benefit of a micro hospital versus, let's say, a large hospital? And let's not just talk about small rural areas. Let's say a micro hospital in a big city. There's certain benefits there to going to a micro hospital. So talk about those.
No, a micro hospital is really beneficial in a lot of cities and a lot of settings, and big cities, small cities, so on and so forth. The biggest advantage of a micro hospital is that it's small, it's efficient, the care is probably faster, and the care is a lot better. So like, for example, I would love to put a small hospital in Manhattan. And the reason that Manhattan, as an example, will benefit from a small hospital is because, for example, in Manhattan, you have what I call a dichotomy of healthcare. You have a bunch of very small urgent cares and say walk-in clinics, CVS clinics, Walmart clinics, so on and so forth. And then you have the much bigger hospital systems. So let's just say if somebody comes in with abdominal pain, the patient with abdominal pain, when they go to an urgent care, they will find out that the urgent care cannot take care of them. And then they will then be asked to go to a much bigger hospital where they wait 9 hours. And so that's where we come in. We take care of the patient that has a mid acuity, like an abdominal pain patient, and where they don't have to wait the 9 hours, but yet we have all the bells and whistles, as well as the expertise to be able to treat somebody like that. And no one else in the country is doing that. We're definitely the leader in that space of healthcare.
Dr. Vo, why is there larger staff burnout in larger hospitals, larger facilities, opposed to a smaller place like yours?
It's all about culture. It's all about the way that you treat your staff. Unfortunately, a lot of these big systems, their culture is much more corporate and much more sort of heavy-handed. And so when you're a staff that work at a big hospital system, you're basically another cog in the wheel. Whereas with us, it's much smaller hospital, much smaller setting, much more family-like and oriented. And not only that, since in our model, most of our physicians are owners in the hospital, as well as the real estate, the physicians at the local level make sure that the staff are engaged and feel like they fit in and they feel like they're part of the team. And so when you do that, basically everything rolls downhill. Patient care is better, revenue's better, costs are less. And so it's a win-win situation when you have that kind of culture to basically incentivize everybody.
Hey, Tom, talk about Nutex itself. By the way, stock symbol NUTX. Let's talk about Nutex and your model and where you guys are in the arc of your story. How many hospitals are planned? How many are deployed? Where are we at right now? Where are we going in the next, let's say, 18 months to 5 years, in your opinion?
Yeah, so we have 22 locations that are open right now in 8 states. We have plans to open between 15 to 20 more locations in the next 2 or 3 years, and we're going to add 5 additional states to our portfolio. And really, the honest truth is that this is just the tip of the iceberg. We get requests from all over the country to open these hospitals simply because of their useful to society. And so every day I get a phone call from somebody around the country and around the world to help them open a hospital. So like the other day at 2 a.m., a doctor called me up and wanted me to open something in Atlanta, Georgia.
Wow.
The week before that, South Carolina, North Carolina. The week before that, Puerto Rico. Week before that, in Maui, where the fires are. Apparently they have 2 million visitors a year, but yet they only have 1 hospital. And even with our hospital being being small, it's definitely helpful to that market. And then week before that, Washington State. So my point is, we get requests all over the country. We can't keep up with all the demands that are out there.
And Tom, how long does it take you to open a hospital?
I would say about 18 months.
Wow.
It just depends on how fast you could get the city and the county to basically buy into the story and buy into the product line. Like in Florida as an example, takes a little bit longer because no one has ever opened a micro hospital in Florida before. And so the Department of Health in Florida is being cautious and trying to understand the model. But other states that we've opened it, like in Texas or Arizona or Oklahoma, they understand the model, and so that process takes a little bit faster.
Tom, we were talking about before you came on the air here, if there's state issues, and you just brought that up. What is the main pushback, or is the adoption getting easier going forward? Because obviously states have a say in this and where you're going to go. What's been the challenge, and how do you resolve that?
Yeah, well, I mean, so there's what's called a certificate of need, or CON. And so the states that have a CON, it's much harder to build a hospital in there because the people that determine whether or not a new hospital goes in are other hospitals. And so obviously other hospitals will not want.
It's like the Fed Reserve.
Right.
Like the Fed Reserve is owned by the banks that borrow from it, and they said that nobody really knows. So the people that are going to let you know if you're a hospital, you're competitors right away, right?
That's right. So even if there's a massive need, it will be very hard to get in there. And so we focus right now on what we call the low-hanging fruits, the states that are non-CON.
Yeah.
And so we go in there and we open it up, and once again, people love it.
I love it. Tom, thank you so much. I appreciate your time. Can't wait to get you back on the air. Dr. Tom Vo, CEO, Chairman of the Board, Nutex, N-U-T-X is their stock symbol. Go to their website, nutexhealth.com. The future of healthcare, micro hospitals, value-based healthcare, coming to a state near you, it looks like. More of your biz coming up. Stand by.